when given a dignified option. Honorable Speaker and Honorable Senators, we are also committing to ensuring that the most vulnerable among us are not left behind. The national government is currently sponsoring 558,000 indigent households under this chief. And this is the data that we have picked from the social protection system, and it cuts across all our constituencies and our counties. I must also commend Murang'a County, which has set a golden standard by fully meeting its statutory obligation, sponsoring 38,000 indigent households and remitting their full annual premium. Furthermore, through the NGCDF and various development partners, we are sponsoring an additional 62,461 households who are under the indigent program. I urge you, Honorable Senators, to champion this within your respective counties, mirroring this a success to ensure universal coverage at the grassroots level is achieved. Honorable Senators, for long, overseas treatment scheme was a conduit for abuse between doctors, mainly in some countries like India, and doctors in Kenya, where cartels and unscrupulous agents exploited the vulnerable patients and the public purse. The era is over. We have introduced a robust, transparent framework for overseas referrals that puts the patient first and protects our resources. This new policy is anchored on a simple principle. SHA will only pay for overseas treatment if the procedure is not available locally. To enforce this, I have appointed the benefits package and tariffs advisory panel, a team of top experts who have rigorously assessed our local capacity. I am pleased to report that the panel has successfully identified and listed 39 medical interventions that are currently not available in our country. These are the only conditions for which the Social Health Authority will authorize treatment abroad. Further, we have introduced strict vetting protocols. Every referral is now subjected to a peer review by the Claims Management Office to ensure medical necessity. We are also requiring that any overseas facility receiving Kenyan patients must formally be empaneled and contracted by SHA, just like the way we do it for our own facilities in our country. You cannot just walk out of our country, go to a hospital in India, and then be admitted. For example, that hospital must be empaneled the way Nairobi Hospital and Kenyatta Hospital is empaneled. They must also have a formal linkage with a local contracted facility to ensure that when the patient returns to Kenya, there's continuity of care. So that hospital must have a partner in Kenya to take care of our patients. We have capped the maximum payable amount for those overseas treatment at 500,000 Kenya shillings. This will ensure sustainability while granting access to life-saving. This new framework guarantees that we are not exporting our patients, Honorable Senators, and we are not exporting our money to support the health system of other nations. That, I think, we need to make it very clear. We will not export our patients and export our money to go and build the health system of other nations. Instead, we should be investing in our own capacity while providing a transparent safety net for the few complex cases that truly requires it. Honorable Senators, the transition from NHIF to SHA is not merely a change of logo. It's a fundamental restructuring of our national health insurer to ensure efficiency, integrity, and professionalism. We are building a new institution from the ground up, and this requires a fresh, competent workforce. I wish to be categorical that recruitment into SHA is strictly based on merit. There is no automatic transition. However, suitably qualified staff of the former defunct NHIF will be given priority in compliance with the law and the court order. The days of nepotism and incompetency are behind us. Only those who prove their worth will serve the people of Kenya. The second pillar, Honorable Speaker and Senators, is comprehensive healthcare information technology system. Honorable Senators, to ensure efficiency and integrity, we cannot manage what we cannot measure. Through the Digital Health Agency, we have successfully digitized and linked 10,277 health facilities with 4,149 public facilities, fully running on our Taifa care system. We have delivered over 30,087 digital devices to facilitate across the country. But this system is more than just a digital record book. It's a fortress. We have deployed an advanced artificial intelligence and big data fraud engine. This engine records every transactions and detects anomalies, billing patterns. For example, upcoding, fabricated records, duplicate claims, impersonation in real time. It is instantly blocks suspicious claims for manual forensic review before a single shilling is paid. It's through the AI and the big data engine that we were able to detect the anomalies that led to the 12.7 billion shillings in rejected claims. And let me also make it to the senators that this is from April to November. I'm yet to go back to when the SHA started, October, November, December, and January. And when that is analyzed by the system, because the system that time was very young, there was a lot of manual, then more and more claims would be rejected. Honorable Speaker and honorable senators, we did not wait for the media to expose the scandal. We are the whistleblowers. In fact, the 11 billion came from an interview I gave to the nation. And if you read, if you leave the headline of that day and you read the content of inside, it has a different story. Guided by the data from this engine, the ministry has initiated several purges. We have formally submitted 1,188 files of fraudulent and non-compliant claims to the Director of Criminal Investigation. Currently, 248 healthcare facilities across the country are under active investigation by the DCI, and we have the documents to table. The DCI has forwarded 30 case files to the ODPP with 9 cases already pending before court. Senior people, including 2 former CEOs of SHA and key members in the Claims and Accounts Department, are facing criminal charges in court alongside the facilities. 26 suspects have been arrested and charged, including facility directors, former SHA officials who collude to bypass the controls. We have aggressively, Honorable Speaker and members, executed financial recoveries, recouping close to 305.8 million through administrative surcharges. And this is where facilities, when we face them with the records from the system, some facilities say we are ready to reimburse the monies that we took, which now has been found that that money was not ours. So we have recouped close to 3 or 5 million shillings.